Misconceptions are something that we haven't been talking about so much, but as you realize, and as many of you already know, a lot of these are widespread throughout the GMO technologies, and they have threatened progress both in the development of products, but also in the development of regulatory frameworks, especially here in Africa. Governments have feared to progress with regulatory frameworks because of misconceptions that have spread around, but also even those countries where fantastic products were and probably are still in development, a lot of those tend to be affected by misconceptions that misrepresent the technology to the communities and the policymakers and all sorts of stakeholders. I have spent a long time working in the National Agriculture Research Organization in Uganda as a biotechnologist, up to participating in a lot of regional efforts to build frameworks, to build capacity, not just in the research itself, training graduate students and the like, but also advocacy work for genetically modified crops, most especially, but also engaging policy, and as well as becoming more or less a communicator for this technology. And so I will share with you a few ideas to let us think about these misconceptions, and also to be aware of them as we move forward into new technologies addressing issues in livestock and human health. They are mainly caused by lack of awareness. This, we found, was the main cause of misconceptions. Some of them are coming out of cultural and religious beliefs. Most important here is when you will engage religious leaders, for example, or even cultural leaders. They talk about playing God, and many people don't want the idea of playing God. There is a fear for foreign control, especially seed. I've singled out seed because in the analysis we've made, we have realized seed food, and foreign control of seed seems to be the biggest concern, at least in most of the countries where most of the staple foods are seed-based. Health and safety concerns, yes, this is also coming out on a regular basis. Environmental concerns such as biodiversity loss, especially loss of indigenous foods and other plant species that the common African farmer cannot see anymore. They start to blame the loss of these varieties on introduction of new crops and new seeds. Regulatory and institutional frameworks, there's always a debate where the regulatory framework should be domiciled, which ministry. And many times we have seen, this is also another piece of analysis, that when the law and the regulatory framework is within the environmental sector, it seems to work better than if it is outside, and less criticisms come up. Political and economic influences, and this one is mostly driven from external forces, foreign funded NGOs and non-government organizations with an anti-GMO agenda have been well funded within many cities in Africa. They have recruited a considerable number of local NGOs and have been funded with money and time and expertise to actually decampaign very actively the development, not just of the products themselves. Again, they even fight establishment of the laws and regulations. So this is an example I will just highlight. A lot of negative stories come up in the news, and we try as much as possible to respond, but considering that we also are scientists and developers with a lot of other things to do, we don't have as much time to respond and write stories and train and communicate as much as what the anti-NGOs have. One case in point here, ActionAid. I think many people know ActionAid. It's a respected NGO out of UK. It works in communities to uplift communities, reduce poverty through environmental issues, which is most likely going to be agriculture and gender issues and youth issues. They were found to have actively decampaigned and misled the communities about, first of all, what GMOs are, what GMOs can do, and all the associated aspects. And we managed to engage them, and they did publish some apologies in the papers. So you could see we could prove that externally funded NGOs were actively in Africa, in different places, decampaigning and creating the misinformation that as we saw, derails projects. So we, of course, I must say here that a lot of the crop-based technologies did not foresee that communication, public engagement, as we're discussing now, were going to be very important. So they didn't have funding, or they didn't provide for funding to do these specific activities. Because if they had, then we would have another group of communicators, public engagers that we would work with as scientists, so that we have a critical mass that delivers the correct information where it is needed. So in kind of a way, we had to break ourselves into two, and many times we were not as effective in delivering the correct information as would have been needed. But we did do a lot of work, as has previously said this morning. Science communication and public education, of course, we try to train ourselves as scientists and to train the media and to create communication tools that simplified the science, the jargon, and engaged policy makers, we engaged farmers. Whenever we had field trials, we have this seeing is believing concept. So we tried as much as possible to bring policy makers and regulators and key informants to the field trials to show them the differences and the value of the technologies that were being developed. We did videos and other media materials that we hoped would use. Sometimes we were not able to cover the expanse of public engagements that were needed. So we tried as much as possible to debunk myths by providing evidence. We did TV shows, we did newspaper articles. One of the things that I think we concentrated on a lot later was the collaboration with the media cafes, like has been mentioned, to try and create again that other that partnership, that we have a class or a group of media friends that we can use to disseminate the information that we need to the public. as well as addressing socioeconomic concerns, explaining issues around seed, types of seed, the F1 seed, for example, hybrid seed, and then the crops that do not necessarily need true seed for planting, and creating that, what sometimes we thought was basic knowledge, but unfortunately it was not. Anyhow, new genetic tools start to come up, and the application of transgenics or application of gene technology starts to move into new areas, into animals, into humans, and we see that the narrative begins to shift from GMO, as many of you have heard, into gene editing. In the first 2 days when we had our communication training, we're trying to move towards using the new terminologies so that we reduce on the criticism of the old GMO terms, and we're trying to build new ways to use those terminologies. We now see issues of GE applied to animals, livestock, disease control and productivity enhancement, such as vaccines and new breeds. But we are also faced right now with similar tools being used to address human diseases that were previously difficult to treat: cancer, sickle cell, and HIV/AIDS. These are some efforts across those sectors in Uganda. We have an anti-tick vaccine, which is a recombinant vaccine that is now already being trialed. It's in, I think, farmer participatory trials, observation trials. So the candidate vaccine is already being used on farm. And, you know, when you start talking about the vaccine being a product of a GMO process, you start to feel, oh, okay, you know, you can do these things as well. So you start to feel the appreciation that the GM technology is not just crop seeds and those things, but also the health of your livestock and reduction in the use of acaricides, which are quite dangerous, both to the animals, the farmers, and the environment. The famous mosquito technology, which we are engaging with a team at Target Malaria, to start to create some of the communication tools, as you see a little pamphlet going around, to start to build that awareness on the technology and how, you know, it's GE technologies helping in controlling human diseases. We have a team, again, at Uganda Virus Research Institute working on a COVID vaccine, and they are going the mRNA route. So again, those are GE technologies, as well as a team working on gene therapy for sickle cell anemia. So we feel as we go into these new technologies, we broaden the narrative out of just crops that obviously have suffered the wrath of misconceptions. So of course we continue to engage. We rather concentrate on the technology value, I think. When we try as much as possible, yes, we can break the jargon, but there's some jargon that is extremely difficult to break. Some terms are just going to be there. If you try to break them, then you're going to mean something completely different. So I think we can concentrate on the value of the technology as we break down the terminologies and start to speak to the public, to the people we are engaging at especially lower levels, rather than the process of generating this technology. I think even they don't need it that much. I believe this is also one thing that was brought into the picture, brought into the debate by the anti-activists. And that's why you will see pictures of an injection in a fruit, an injection in a in a food. All that is trying to bring processes into the discussion and creating unnecessary fear. I think social media tools are going to help, especially bringing the younger people into awareness. As we know, in Brazil and other places, working with schools in South Africa has also helped transfer this knowledge back home into the community. And I think that's one tool we can use. We did use it that much previously. Public participation at various levels. Various levels, obviously, I mean that the messages are tailored to different levels at participation, public participation scale. In the past in Kenya, when we were applying for deregulation of cassava, we actually did the public participation using online tools because it was in need of COVID, lockdown, and we were not going to do workshops to get public to. So we did a lot of schools, institutions, and we did collect perhaps more data than we could have collected, much cheaper than if we had collected people to workshops and the like. So again, there's an opportunity to use electronic tools to engage the public for purposes of information or purposes of participating in decision making. Media partnerships must continue, and I think we will continue to do that, broadening the narrative from crops to health and engaging the religious and cultural leaders. We discussed this in the first 2 days here too, and I think we didn't do a good job with these leaders. They command big fellowships, and people want to hear them. People want to listen to what their opinions are, and we need to find ways of engaging them. I've had here in Ghana, there's one who is really ferocious. I think that we need to find ways, tools of engaging them, bring them to understanding what we do, and then they will definitely help a great deal in disseminating this information. And a regulatory trust needs to be built as well. I think that some of the resistance that we see is people don't know even the regulation exists. People don't know that there is a whole process through which the technologies are reviewed for safety, for socioeconomic impact, and all those things before they're indeed released for them to use. So we need to build the understanding, to build the awareness about the regulatory frameworks, and therefore the trust in it, and people will be happier to use these technologies. Thank you.